If you've watched the videos about the process of allogeneic or autologous stem cell transplantation, you probably remember that we compared the therapy to a journey over a mountain. And just like with any journey, no matter how much you plan, there can still be things that happen along the way that you didn't expect or that are unwanted. The same applies to the procedure of a stem cell transplantation. Both allogeneic and autologous stem cell transplantation can involve various risks and side effects. Unfortunately, it's not possible to cover all potential side effects in a single video. That's simply because every case is far too individual. That's why it's best to discuss this important topic and any related questions personally with your doctor. Instead, we will focus here on the most common risks associated with a transplantation. But what's actually the difference between side effects and risks, you might be asking now? These terms are often used as if their meaning is self-evident, even though it's not always entirely clear. So, a risk describes the potential danger that something undesirable could happen. Side effects, on the other hand, are unwanted reactions to a medication or treatment, such as nausea or headaches. So these are very specific symptoms, in other words, complaints that you might experience. For example, if you see a big thick cloud in the sky, there is a risk that it might start to rain. Exactly. The unwanted side effect that results from this would be that you end up soaked to your underwear. So it would have been good if you had listened to the weather report beforehand and packed an umbrella. It's similar in this case. It's important for you to know what risks are involved in a stem cell transplant. This knowledge can help you recognize problems early or even prevent them. At the same time, it's also clear that you can never completely eliminate all problems. And that's why we're now going to go through the most important risks together, step by step. So the first risk you absolutely need to know about is the risk of infection. Before the transplant, you or your child will receive a particularly strong chemotherapy, sometimes even combined with radiation therapy. As a result, the body's own defenses are almost completely shut down. After the transplant, the immune system has to slowly start working again. Accordingly, during this time, you are very susceptible to all kinds of pathogens, viruses, fungi, bacteria, basically everything. For example, it's very easy to get pneumonia, which can become life-threatening if not treated. To prevent this, everyone involved must adhere to strict hygiene rules. Your treatment team will definitely talk to you in detail about what is especially important here and what you should pay attention to. In addition, you or your child will receive preventive medications such as antibiotics to protect the body from infections. So that's already taken care of. The other risks we are going to discuss now only apply to those patients who have received donor stem cells from another person, meaning those who have undergone an allogeneic stem cell transplant. Here, the main issue to mention is the so-called graft versus host disease, which I'm going to explain to you now. In this context, the transplant refers to the donor's stem cells, and the host is the recipient, meaning the person who receives the transplant. A graft versus host reaction occurs when the donor cells perceive their new environment as foreign and attack the recipient's body cells. This happens because the tissue characteristics of the donor and recipient almost never match 100%. The tissue characteristics are determined by hereditary factors, that is, by genes, and are also referred to as HLA markers. Of course, important tissue characteristics of the donor and recipient are thoroughly examined in advance to ensure the greatest possible match. You can learn more about this topic in the video about donor search. Nevertheless, there can be subtle differences in the HLA markers that can trigger a rejection reaction of the donor cells against the recipient. This rejection reaction can primarily affect the skin, intestines, and liver. For example, the skin may become inflamed, meaning it can turn red or itch, or you might get diarrhea or jaundice. To prevent these reactions from becoming too severe, you or your child will receive appropriate medications known as immunosuppressants. These make the donor cells less aggressive. At the same time, however, the goal is also for the donor cells to go into attack mode in order to completely destroy any remaining cancer cells. So the whole thing is quite a tricky matter, but the doctors usually find a good middle ground for each individual patient. And in some rare cases, it can also be the other way around. In those cases, the recipient's body fights back against the donor's cells. So there is a risk of rejection. This means that the donor cells do not grow properly or do not grow at all in the recipient's bone marrow. Then, too few new blood cells are produced, and what can help in that case are immunosuppressive medications or ultimately another transplantation. Most of the time, a different donor is chosen for this. Now you know the most important risks associated with the treatment. Fundamentally, it must be said honestly that a stem cell transplantation is not an easy path, but it offers the chance for a cure and has already helped many children and adolescents to overcome cancer. Maybe that will give you some courage. Yes, to remember that you are not alone. Many others have already walked this path before you and have managed the arduous journey over this mountain.